is Guardian Radio, your station for up-to-the-minute news and intelligent, interactive, and engaging conversations. 96.9 FM. The views and opinions of the hosts and guests are their own and do not necessarily reflect the views of the management and staff of Guardian Radio.
With early detection comes early prevention.
But letting your pencil make you feel like a champion.
Rise up again, let nothing keep you down. To live your best, hear the urologist speak. Oh yeah.
Think you're losing grip of your manhood, don't give up on hope.
Don't be ashamed, it's time to take control. Get some help from the urologist.
You will find
He'll help you solve your problems
on 96.9, yeah.
I telling you, with early detection
Comes early prevention.
but letting your pencil make you feel like a champion.
Rise up again.
Let nothing keep you down. Live your best. Hear the urologist speak.
Good evening, Bahamas. This is Bahamian Urologist Dr. Greggory Pinto. Unfortunately, I'm alone in the studio today. My co-host, Dr. Wesley Francis, is still abroad, but he'll be back next week. I had a topic in mind for this evening. However, with popular demand throughout the week, in fact, I can count 7 persons, male and female, today who asked me to please speak about the all-important topic of erectile dysfunction. So I'm going to change my topic at the last minute and just talk from the cuff, and we're going to talk about all aspects of erectile dysfunction. I would love to hear your calls and your comments. So I've said this many times, and it's blatantly obvious to anyone who's ever lived in the Bahamas that the most important organ for a man is his male organ, his ability for that male organ to achieve and maintain an erection in its fullest glory. And unfortunately, we have a country that has a pandemic of non-communicable diseases, a very unhealthy nation as a whole. We have as many as 1 in 7 adults having either prediabetes or diabetes, number of persons who are obese or overweight, even in terms of children, at least 1 in 4 are overweight or obese, where we are one of the most obese nations in the world. I always say that's a crying shame. That's not something to be proud of, and the trend is just getting worse and worse. But I'm here to speak and give persons hope in terms of erectile dysfunction. Erectile function is integrated with general well-being of that male in terms of making sure that all their bodily systems are working, because anything that's going wrong, whether it's diabetes or hypertension or heart disease or high cholesterol or low testosterone or obstructive sleep apnea, can negatively impact the ability to get an erection and sustain an erection. So how do we define erectile dysfunction? There are 2 main questions. Are you able to achieve an erection adequate for penetration? And the second question, are you able to maintain that erection until orgasm? So it's either yes or no answers to these 2 important questions. So just thinking about it, just one episode of erectile dysfunction, it doesn't even have to be physiological in origin. It could be stress. It can be fatigue. It could be a hard day at work. It could have been a late night from the night before where you didn't get any sleep. It could be fighting with your wife or your girlfriend that can lead to you not maintaining or even achieving an erection and you letting yourself down, letting your partner down. But as we age, it's inevitable that men are going to get erectile dysfunction. It usually goes by decades, at least 40% of 40-year-olds, 50% of 50-year-olds, and when we talk about men 60 and above, ovary dysfunction, particularly in this country, we have a high incidence of non-communicable diseases that unfortunately are very poorly controlled on the whole. So when you get one episode of erectile dysfunction, it becomes or can become a very vicious cycle. So one time you're failing yourself, the next time you have a sexual encounter, a man will place almost a self-defeating pressure on himself. He's unable to relax. He's full of anxiety. He's preoccupied with failing, which in itself can cause an erection to fail. He's thinking, please don't let me down. Please don't let me down. Please don't let me down. Maybe it was made even worse by the last episode of erectile dysfunction. His partner making a negative comment. Maybe you're not man enough for me. Or maybe you don't find me attractive as a woman anymore. Or maybe I put on a little bit too much weight. Or maybe all of a sudden, maybe you have a sweetheart because you're not interested in me and you can't get an erection like you used to. So men don't want to hear this, particularly when they're not guilty of it. So they're going to overthink the situation. And in that, it's almost self-defeating because you're going to cause yourself to fail because you can't relax. All you're doing is preoccupied with, let me not let her down, let me not let myself down. The psyche, the self-esteem of a Bahamian man is integral with his erectile function. So he's probably already feeling low self-esteem because he failed on that one occasion. It can be devastating, particularly if this vicious cycle continues and continues. But you just have to be mindful that everybody faces erectile dysfunction at some point. There's no embarrassment in seeking help. In fact, seeking help can actually save your life. There's a strong correlation in early cardiovascular disease. For men who have particularly early onset of erectile dysfunction, it can be numerous things. It can even be psychological, it can be emotional, but we need to ascertain and determine whether something more sinister is going on. Is that evidence of early cardiovascular disease, where if we can treat you and diagnose you with early cardiovascular disease, and maybe we can employ behavioral modifications, diet modifications, we can get you to exercise routinely, reduce your weight, eat right. If you are not taking your medication for hypertension or cholesterol, make sure you, in fact, take your medication. Make sure you get a good night's sleep. We can prevent you possibly from getting a heart attack 7 years, a stroke 9 years down the road. So it can actually be life-saving. Just in terms of looking at what are the possible causes of erectile dysfunction, we could talk about impairment of your blood supply. Common sense, and I've said this many times, when you have impairment of the blood supply, when you have plaque deposition, many times it's related to high cholesterol, hypercholesterolemia, or a form of atherosclerosis, you're always going to get plaque formation and blood supply impairment in the smaller blood vessels before the larger blood vessels. So it's going to affect the small blood vessels that are going to affect your penis and your male member that allow you to get a good erection before it's going to affect the larger coronary arteries that supply your heart, or the cerebral or vertebral arteries that supply your brain. So if we can prevent you from going down that road where you're going to develop coronary artery disease, or you're going to develop artery or vertebral artery stenosis, then we can prevent a stroke. We can prevent a heart attack. We can improve not only your quality of life because we're maintaining your erection, but we could also improve the longevity of your life. So we're trying to be proactive. We're trying to pick up things early. We're trying to make sure that we can prevent you from getting non-communicable diseases by having a healthy lifestyle early in life, and that includes even from young childhood, eating right, getting exercise, having healthy habits, and having physical education as a routine in your week, in every single week. So having good habits start early, and it's ingrained in us. And if you're going to live healthy as a teenager, as a 10-year-old, as a 12-year-old, you're more likely to live healthy as a 20-year-old, as a 30-year-old, as a 40-year-old. So you don't wait until you're 40 years old and erections start to fail you, and then all of a sudden you decide, all right, now I'm going to start taking my health seriously. Oh, okay, I'm going to stop smoking cigars and cigarettes. I'm going to actually stop having 6 beers a night. I'm going to lose this extra 35 pounds. I'm going to actually take my high blood pressure medications. Let's start from early and be proactive and preventative. That's an important mantra for this radio show. preventative medicine. Let's not just be reactionary. Let's not just react when something happens. Let's prevent things from happening down the road. So when we talk about the causes of erectile dysfunction, and they're numerous, and in many cases it's not just one cause, it's more than one cause. We talk about medications and the various side effects, and there are numerous medications that can affect different individuals in different ways and to different degrees. So particularly certain high blood pressure medications such as beta blockers, there's some form of erectile dysfunction for some persons. But it doesn't mean you stop taking your high blood pressure medications. You go to your physician and you tell him that you're concerned that possibly there's side effects from this medication that may be affecting your erections, and they can change you to another medication that maintains your blood pressure and makes it sure that it's well controlled, but yet doesn't negatively impact your erections. So stopping the blood pressure medications because you see it might be impacting negatively your erections, all you're doing is creating a problem that is not going to manifest probably for several years, where you're irreversibly damaging the blood supply and the nerve supply to your penis, and you're going to develop long-standing and severe erectile dysfunction. Antiandrogens, antipsychotics, antidepressants, prostate medications such as finasteride, dutasteride can negatively impact your sexual drive. It can negatively impact the ability to maintain and achieve an erection. So anytime anyone will see a urologist or any physician for that matter for erectile dysfunction, we're going to do, as we do with any patient, what medications are you on? What doses are you on? When erectile dysfunction first struck, did you start any new medications, or was there any increase in the doses of any of those medications? Was there any change in your diet or your lifestyle? Was there any traumatic event in your life at that time? So you can never underestimate the psychosis of it all, the psychogenic erectile dysfunction, the stress, particularly for younger men in their late teenage years and their early 20s. It's not very common for men to have an organic etiology for erectile dysfunction at that young age. But of course, sickle cell disease, that can manifest with even profound erectile dysfunction at 17. You can have early onset diabetes. You can be born with insulin-dependent diabetes. And insulin and diabetes goes hand in hand, where at least 25 to 33% of all diabetics, even well-controlled diabetics, are going to have some element of erectile dysfunction. So how do we treat persons with erectile dysfunction? Again, the mantra for this show, the urologist speaks, is in medicine, you always treat the root cause. You don't just treat the symptom, because as you're treating the symptom, whatever the root cause is continuing to get worse and mushroom out of control and become more severe. And even treating the symptom is not going to be of any use, because those medications such as the blue pill, the Viagra, the Levitra, Cialis become less and less effective. So borrowing your friend's Viagra, first of all, can be dangerous. You never borrow medication from anyone, because you don't know what might be the interplay or interaction between that medication and medications that you may be on or conditions that you may have. For example, PDE5 inhibitors, which are the Viagras, the Cialis, and Levitra, it's contraindicated in persons who have unstable angina, where they take nitrites, where they had to put the nitrite on their tongue because of the paralyzing, crushing pain in their chest. If you take a nitrite and a Viagra, that could be the end of you. And not only that, just as I said, taking the medication is not treating the root cause. What if you have diabetes and you're not treating the diabetes? First thing that's going to go is your erections, and then it's going to affect your heart, then it's going to affect your kidneys, then it's going to affect your liver, then it's going to affect your eyes. So if we can determine what is causing the erectile dysfunction early on, when it first started, we can prevent you from having other organ damage that may unfortunately become irreversible if it's left to stay without being treated. So please stop this fear of or embarrassment of not seeking help for erectile dysfunction, because it literally can save your life, and it definitely can improve the quality of your life just from the standpoint of being able to rise again whenever you want. And it could also positively impact the longevity, the number of years on this earth for men. So I spoke about Viagra, I spoke about Cialis. I will mention, I would love to hear your calls. You can call me at 323-6232 or 325-4316 or 326-4259. What does Viagra do? What does Cialis do? What does Levitra do? As I mentioned, they're a special class of drug called PDE5 inhibitors. But how do they work? So we have to look at the physiology, the pathophysiology behind getting an erection. So erections are induced by the parasympathetic nervous system. So erections are brought on by visual or auditory or tactile or any sensory stimulation. And when that happens, the nerves secrete NO, which is nitric oxide, which will then go to the penile endothelium. And as the nitric oxide increases in abundance, it releases an important compound called cyclic GMP. And what that cyclic GMP does, it causes the intracellular calcium to decrease, and it leads to the dilatation of the sinusoids in the penis, which in fact leads to the blood vessels diameter increasing and the pooling of blood within the penis itself and leads to engorgement. But there's a substance that works against this, and that's called phosphodiesterase. It's a bad substance when we talk about erectile dysfunction. So what does phosphodiesterase does? It basically eats up the cyclic GMP and leads us to lose an erection. So what does the Cialis and Viagra and Levitra do? It blocks the phosphodiesterase. So it allows for the cyclic GMP to be around for longer. It allows for increased amount of nitric oxide. It allows for increased dilatation of the blood vessels. And in the penis itself, there are two chambers that fill with blood. And those are called the corpus cavernosum. So when we have pooling of blood in the cavernosum, to allow the pooling to be ultimate, you want to have limited phosphodiesterase. So you want to use phosphodiesterase inhibitors such as Viagra or Cialis. But there's several types of phosphodiesterase throughout the body. In fact, there are 11 different types. The one that acts at the level of the penis is type 5 phosphodiesterase, but there are other types, such as type 6, that works at the level of the eye itself. There's type 11 phosphodiesterase that works at the level of the back or in the muscles, particularly in the calf muscles. So many of these erectile dysfunction medications, such as Viagra or Cialis, work on different forms of phosphodiesterase, and that's why we have side effects. For example, Cialis has a side effect of affecting not only the phosphodiesterase number 5, type 5 in the penis, but also type 11. And what does this do? It can cause the side effect of back pain and muscle cramps, as well as giving you good erection. Viagra has more cross-reactivity with type 6 phosphodiesterase, which could lead to ocular side effects. It could lead to eye pain. It could lead to redness of the eyes or irritation of the eyes itself. So ideally, we want a phosphodiesterase inhibitor that only works at the level of the penis and only affects type 5 phosphodiesterase. And there are very few medications available that do that. In fact, there's only really one that is shown to do that. And that's called Evanofil. And that was just recently introduced to the market. So it has very few side effects. It really only works at the level of the penis, gives you a great erection. But unfortunately, it just came out in the market. It's very expensive. But because it just came out, there are no generics. So unfortunately, you have to pay the greater cost. But if you have side effects from Viagra or Cialis, Evanofil will work in most individuals very effectively without the side effects. Okay, we have a call coming in. Good evening. This is Urologist Speaks.
Yeah, Doc. Good evening.
Good evening.
You may be able to get some volunteers to test your new expensive pill or treatment that's coming out. And then
I'm sure there'll be innumerable persons lining up.
Yeah, okay. Yeah. But this erectile dysfunction, I remember you telling me some time ago about calcium.
Yes.
when I was in your office.
Yes.
And now that's connected to.
So as I mentioned, when we talk about, it's very technical, obviously, a lot of people don't want to hear that, but when we talk about, essentially, erections are brought on by the parasympathetic nervous system. The nerves stimulate nitric oxide. The nitric oxide then invades the penile endothelium, and it leads to the release of cyclic GMP, and the cyclic GMP reduces the intracellular calcium. And what is the effect of reducing the intracellular calcium? That means you have dilatation of the blood vessels and allows for increased blood pooling and engorgement of the two chambers within the penis, which are called the paired chambers, which are called the corpus cavernosum. So part of that is the intracellular calcium, part of the erectile function pathophysiology is reducing the intracellular calcium.
Oh, so calcium is playing a positive role here.
In reducing the calcium intracellularly, yes, it does. But in terms of what can we do to naturally improve our erectile function, we need to live healthy. We need to avoid cigarettes. We need to avoid cigars. We need to drink alcohol sparingly. We need to have a normal body mass index. We need to have exercise. We need to reduce our processed food intake. We need to essentially eat healthy. And emotionally and psychologically, if we have stress in our life, we need to have an outlet for that. And that may be in the form of yoga, that might be in the form of exercise. So essentially, having good erectile function is basically the cornerstone of us having good health.
Well, but you need to mention also that you need to know who you are.
Very much so. You have to have a confidence in yourself. You need to have a confidence in your relationship, and you have a confidence in your partner. There are a lot of dangerous, deadly sexually transmitted diseases out there, HIV, AIDS, hepatitis, etc. So you're not going to obviously be at ease. You're not going to be, if you're not in a committed monogamous relationship where there have been episodes of one partner getting a sexually transmitted disease or infidelity, etc. So there also has to be a trust. There has to be a bond as well. And that all has an interplay in terms of having good erectile function. And it's not just men who suffer from erectile dysfunction. Obviously, the females suffer from it as well. I'll also talk a little bit about female sexual dysfunction, which is an entity in itself, particularly as women enter menopause.
So there's something I can give you to suggest to your partners who may be experiencing this, right?
Yeah,
Dream therapy. Dream therapy works.
There are lots of forms of therapy, and some of them even have the placebo effects. So if you believe in it, and it's not really doing any harm to you, if you believe having a Guinness can make you the greatest lover on earth, or you believe having some conch, and you truly believe in that, that confidence boost will allow you to perform in many cases. If physiologically there's nothing inhibiting your nerve supply, your blood supply, or you don't have issues with low testosterone. So you can never underestimate the placebo effect or believing in yourself.
Thanks, Doc.
Thank you very much for your call. So we talk about female dysfunction, and a lot of that stems from there is no true female Viagra. There are medications that can help, particularly for women who have issues with arousal or desire or have orgasmic dysfunction, particularly as women have lowering estrogen levels as they get older. A lot of women will have what we call atrophic vaginitis, where it's very discomforting down there, whether they're sexually active or not. There's also the issue of women not lubricating as much, particularly after menopause or if they're 40 and older. And I'll always advocate for, if there's an older female, to use a water-based lubricant. It can bring back your sexual enjoyment for yourself and for the male. A female shouldn't be having painful intercourse, and there are many reasons for that. So always see a urologist or gynecologist. Don't suffer needlessly with that as well. But there are medications such as Valesi or Adai that can actually improve your arousal. But I guess the number one treatment, if you receive it, is actually HRT, hormone replacement therapy in terms of women who have issues with sexual dysfunction. But that's a huge topic in itself. But what is it about aging? As I mentioned, 40% of 40-year-olds, 50% of 50-year-olds, and over 70% of 60-plus-year-olds have some form of erectile dysfunction. So we'll talk about this and more interesting topics related to erectile dysfunction after the break.
Everybody Wins Live is bringing you the ultimate giveaway, a brand new Cybertruck. For every $30 spent, you're in the drawing for the ultimate grand prize, a Cybertruck. Drawn live at the Vibes Cartel concert March 29th. You'll also be automatically entered to win tickets to see the world boss himself. 25 lucky winners every single week. Visit everybodywinslive.com to get into the game. See website for full terms and conditions. Must be 18 or over to participate.
Mommy, guess what I did in school today?
Hold on, sweetie. Mommy's sending a text.
But Mommy, my teacher said that you're not supposed to text and drive.
I know what I'm doing.
Oh, look, Mommy, the Smith twins. Mommy, watch out!
In 2017, approximately 54 people died as a result of traffic accidents. A percentage of these fatalities occurred as a result of texting while driving. Just taking your eyes off the road for 5 seconds can increase your chance of crashing. Remember, even the smallest voice counts.
Texting.
Brought to you by UB Radio and Guardian Radio 96.9.
Always on the go? Missed the show? You can now listen to Guardian Radio talk shows anytime, anywhere on Spotify and YouTube by searching Guardian Radio 96.9 FM or by entering the name of your favorite show. You can also listen by logging on to GuardianTalkRadio.com and clicking on the podcast tab. Guardian Radio, continuing to provide you with fresh news and smart talk anywhere, anytime, all day.
Love the show? Want to give your support? Become a sponsor today. Call 302-2300 for our rates and packages. That's 302-2300. Become a sponsor on Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
This is Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
Welcome back. This is your host, Dr. Greggory Pinto, Bahamian Urologist, and this is Urologist Speaks. We're speaking about erectile dysfunction and all aspects of erectile dysfunction with the take-home message that no matter what, you could always rise again. No matter how many years you haven't been able to perform, if it's 20 years, 30 years, 25 years, if you have no blood supply, if you have no nerve supply, if your testosterone level is very low, there's always methods that we can employ to allow you to rise again to your fullest glory. Even if it goes to the fourth line treatment of getting a penile implant, where if you do get a penile implant, you can rise again with a little push of a button located secretly within your scrotum, where you can get a better erection than you ever got in your life, 20% longer in length than you ever got, and you can rise again as long as you want. The sensation is still intact. You can still have children. You can still orgasm. So you can actually go from a dud to a stud. So never give up hope. But why is it that as we age, we develop higher incidence of erectile dysfunction as men? Obviously, as we get older, we're going to have a higher incidence of non-communicable diseases. We're not going to be as healthy as we were when we were younger. We're going to put on weight as we get older. We're going to have more of a sedentary lifestyle as there's more pressure at work and we don't have the time to exercise, etc. We may not have the time to cook and eat healthy. So we're eating too much processed food, too much in the way of fatty foods and fast foods. But a lot of it is related to the incidence of what we call venous leak, penile venous leak, which is very common as men get older. It's also called veno-occlusive dysfunction. So looking at the anatomy of the penis, I'm not going to bore you. I'm just going to talk about the important facts. There are two chambers within the penis called the corpus cavernosum. They're paired chambers, identical on either side of the penis. And basically, these are filled with muscles and sinusoids. And down the center of each chamber, there's an artery. There's also a thick casing around these chambers that's called the tunica albuginea. And under the tunica albuginea, there are numerous veins. And these veins are called the subtunical veins. So during erections, as the blood pools into these chambers, the blood pushes the muscles against the walls of the chambers. As we age, we get atrophy of these muscles and fibrosis of the muscles of the penis. But we might be able to still get an erection by blood going into the chambers in the penile shaft. But as we get older and there's more atrophy and more fibrosis of the muscles within the penis, this could lead to difficulty in maintaining the erection. So a lot of men, it's the initial, what they're going to find initially when they have erectile dysfunction is they're able to get an erection, but they're just not able to maintain it. And I'm not talking about premature ejaculation where they'll lose the erection because they're coming sooner than they would like. I'm talking about not being able to maintain their erection during sexual intimacy before you're able to orgasm. And that has to do, in many cases, due to venous leak. So when you have atrophy of the and fibrosis of the muscle that's pressing against the chambers, that allows you to maintain the blood within the chambers, that will lead to a lack of ability to maintain the blood within the chambers. So you're able to have blood come in, but you're not able to maintain the blood within. So it's leaking out. So we can think about it simply in terms of how do we overcome penile venous leak. And we look at Viagra and Cialis and how that works. So just in simplistic form, we talk about inflow and outflow. So we talk about what leads to inflow of blood into these chambers to fill it up, and what prevents the outflow to allow us to maintain the erection. And there's important interaction between inflow and outflow. So for example, just thinking about it in simplistic terms, if the inflow, let's give it a number, is 10 in terms of the blood flow into the chambers, and outflow is 15, obviously we're in the negative, and we're not going to be able to not only achieve an erection, but even maintain an erection if we get one. But if we give a man a Viagra, we give a man a Cialis or a phosphodiesterase inhibitor and allow us to pool more blood coming in. And let's give it a number. Let's say the blood now pooling in is gone from 10 to 25, and we still have that negative 15 leak. We still are in the positive. So we're able to get an erection and we're able to maintain an erection. So there are many ways that we can get an erection. Then we talk about some people use a tourniquet method, which can be very dangerous. Some persons use what we call a penile ring, which can lead to tragedy. So they know as soon as they get an erection, they're going to put a iron or titanium ring around the base of the penis, because that basically prevents venous leak. That allows the blood that's pooled into the chambers to stay there. But it can become entrapped. You can lead to ischemia, pressure ischemia. I've had to, over the years, operate on many men who've had these penile rings at the base of their penis where they basically develop necrosis of the penis because the blood has stayed there for hours on end, and it's developed necrosis and fibrosis of the chambers themselves. So if you are going to use a tourniquet, which I'm not going to always advocate, you want to use a malleable one, such as a malleable ring or almost like a rubber band effect. Never use anything that's metallic where it can become entrapped and basically lead to ischemia and lead to a surgical emergency. Men don't want to go to see a urologist for erectile dysfunction, but you think you want to go to the emergency room because you have a sustained erection for 10 hours and your male member is engorged and turning black and blue, and you're in danger of never getting an erection again because of fibrosis of the chambers. Don't ever use a penile ring to prevent you from getting venous leak. It can be exceedingly dangerous. Then we talk about what is not very commonly understood or spoken about, and that's very common in younger men, and that's porn-induced erectile dysfunction, which is a pandemic in itself. So men physiologically look at porn and they basically rewire their pleasure center and are only able to get an erection if they have pornography to stimulate them. So when they then go with their girlfriend or their wife, they're unable to perform because their brain is essentially, in layman's terms, rewired. Then they develop a form of erectile dysfunction with a partner. But physiologically, they're able to get an erection without any problem with pornography. So please do not overdo it with pornography, because that in itself leads to erectile dysfunction. And a lot of men realize that themselves, where they wean themselves away from the pornography because they can see that maybe they weren't in a relationship for several months or several years, and then they're in a relationship, and all of a sudden they realize they still are getting erections with the pornography, but so there's not a physiological issue, but they will develop porn-induced erectile dysfunction because of the rewiring of their pleasure centers, and they basically can't get or they can't sustain or maintain an erection with a partner, which can be devastating on the relationship, devastating to the male and to the female. And then we talk about psychological impotence. Never underestimate the impact of the emotional, the psychological. And it's very common in this society, and I see it all the time with seeing patients. They'll say, you know what, doc, I have erectile dysfunction with my long-term girlfriend, but my girl on the side, there's no problem whatsoever. So that's not a physiological issue. If you have no problem with your sweetheart, I'm not going to judge or cast judgment or anything else. But if you do have a sweetheart, you need to use protection. You need to be safe. You don't want to have an outside child. You don't want to bring home a sexually transmitted disease. There are far too many women in this world, in this country, and in this world who have died of HIV because of selfish, philandering husbands. So please don't devastate your kids by them losing their mother and their father because of careless sweethearting and the lack of use of a rubber. Always use protection, even if it's for unwanted pregnancy or for numerous sexually transmitted diseases that can be your peril and your undoing. So I mentioned about non-communicable diseases, and we are a country which is overwhelmed with non-communicable diseases, particularly diabetes or hypertension. So particularly if you have insulin resistance, where you have type 1 diabetes, it's very difficult unless you have very well-controlled diabetes where where your HbA1c is an acceptable range, where your body is dealing well with glucose and sugar. If it's uncontrolled, that can lead to erectile dysfunction as the first manifestation of uncontrolled diabetes or uncontrolled hypertension or uncontrolled hypercholesterolemia. It could be the first manifestation of low testosterone. And low testosterone can happen for many reasons. It can happen even from our diet. Studies have shown that having a diet which is overwhelmed with sugar, so just as little as 75 grams of sugar which is maybe a Coke and a donut, even in the short term, within 2 hours, reduce your circulating testosterone by as much as 25%. So throughout the day, if you're eating unhealthy and you're having sugar throughout the day or processed foods throughout the day that are negatively going to lower your testosterone, that in itself, your diet or poor diet, can negatively affect your erections. It can negatively impact your stamina, your sexual drive. It can negatively impact your ability to have energy, to maintain your normal body mass index. So it's very important on so many levels to eat healthy and stay away from cigarette, nicotine, and cigar smoking, because there's a strong link between coronary artery disease, atherosclerosis, and smoking. And smoking, the first thing it's going to do is rob you of your erections. It also, as a urologist, smoking can negatively impact your fertility. It can denature your DNA. So if you're trying to get pregnant, you shouldn't be smoking anyway. But make that sacrifice and stop smoking if you're trying to get pregnant. And if you're around your wife or your girlfriend who's pregnant, obviously you don't want to be smoking cigars or cigarettes at all. Excess alcohol intake can also negatively impact your sperm parameters. And it's not just when we talk about male fertility, it's not just the volume of ejaculate, it's not just the volume of sperm, it's other parameter. It's liquefaction of your ejaculate at 1 hour or 2 hours. It's the morphology of your sperm. It's the motility of the sperm. So any one of these parameters can be awry, and you can have perfect sperm numbers, and you're not going to be able to get your partner pregnant. So don't create your own male infertility by having unhealthy lifestyle choices, please. So when we talk about testosterone, as we age, and I've spoken about this many times, we talk about andropause, which is male version of menopause, and that is an entity. So when you are 40 and older, all of us every year are going to lose our testosterone by at least 1% to 2% per year. Some, for many reasons, might lose 5% a year, 10% a year. But we're expected to have our testosterone fall as we get older. It doesn't necessarily mean that we need testosterone supplementation or replacement. It doesn't necessarily mean that even if your testosterone levels are low, that we need to treat you with testosterone. But testosterone is also very important in terms of our being protective for your cardiovascular system. It's also important that we have normal testosterone levels to prevent getting a heart attack or a stroke later down the road. I've mentioned this before. When you look at persons during the COVID-19 pandemic, men who did worse than others. Almost all of us got COVID-19 at one point, but why were those, some of us had to go through the emergency room and be admitted to the hospital? Why did some of us have to be admitted to intensive care unit? Why were there some of us who had to have to be intubated and put on a ventilator? And a lot of it, in studies have shown over time, that was related to low testosterone. Obviously, having cardiovascular disease or having obesity also plays a role, but having low testosterone would put you at greater risk of having a worse outcome if you got COVID-19. The same thing is for our cardiovascular. If you have low testosterone, you're going to have increased risk for developing what we call metabolic syndrome, where later in life, if you don't have diabetes, if you don't have hypertension, if you don't have hypercholesterolemia, you'll be at greater risk of developing it in middle age as a man. Or if you do have them and they were well controlled, it'll be more and more difficult to control it. So as you get older, you're destined to have lower testosterone. You're also more likely to have sleep apnea, obstructive sleep apnea, which is also a pandemic in this country, where men may not even be aware of it. They just don't recognize the body that they're inhabiting. All of a sudden, in the last year, they've gained 40 pounds. They've lost their muscle mass. They have no interest in doing things they used to love. Their sexual drive is poor. Achieving an erection, maintaining an erection is very difficult. They're very irritable. They can be almost in a male version of menopause, where they have heat intolerance or they have night sweats at night. They can be prone to depression. They can change their entire personality, and they might not be aware of it, but their loved ones are very well aware of it, and they often suffer with it, particularly their wife or their girlfriend who sleeps with them. If you're snoring so loudly that you're shaking the walls, and your girlfriend or your wife isn't getting a good hour sleep at a time because of this snoring, and not only that, they're overly concerned because repeatedly throughout the night, it could be every 5 minutes, it could be every 10 minutes, it could be every minute, you stop breathing for a few seconds, almost like you're choking on your breath, where your body all of a sudden takes you from REM sleep, deep, rapid eye movement sleep, to non-REM sleep, where your testosterone needs to be replenished throughout that from what you use throughout the day only happens in REM sleep, deep sleep. If you have obstructive sleep apnea, you can sleep 12 hours and be like a zombie because you're basically having superficial, shallow sleep where it's predominantly non-REM, non-rapid eye movement sleep. You're not dreaming. You're not replenishing your testosterone. So what's the consequence of that? Your testosterone is going to fall. You're going to put on more weight. The consequence of you putting on more weight is you're going to make the sleep apnea worse. The consequence of you having lower testosterone is going to be that you're going to cause that low testosterone to get even worse, which is going to cause the sleep apnea to get worse. And it's just a vicious cycle that just basically ruins your entire life because you're walking around like a zombie, a shell of your former self, someone that you don't recognize. You're reducing your quality of life on this earth. You're reducing the longevity of life on this earth because there's a strong correlation between poorly controlled, moderate and severe obstructive sleep apnea and cardiovascular events such as a heart attack and stroke. We have a call coming in. Good evening. This is Urologist Speaks.
Good evening.
Good evening.
Dr. Pinto. What I'm calling about, right, about 4 years ago, I was on the internet and I saw something, this doctor, what's her name, Rachel Ross, said that mouthwash interfere with your erection.
Well, I always say, don't let Google be your doctor. I went from undergrad to grad to medical school to postgraduate training, general surgery, urology, and fellowship, 17 years. So you can never read something in Google, and there are a lot of people who are trying to make a name for themselves. There are a lot of even studies that are not accepted by the medical fraternity itself. So you always have to look at, is a reputable medical journal that is publishing this article. You have to look at, there are a lot of dangerous podcasters that are out there who are giving unfiltered information that's completely incorrect. But no, I've been studying erectile dysfunction for many years. I've never heard of any correlation between mouthwash and erectile dysfunction.
That's what I thought, because I stopped using it, but because I just experienced it once, but I stopped using it now for over a year. But
and did it help?
Okay now. But what I ask you again, can you give me the figure of the implant price?
So unfortunately, the penile implant is the last resort. So,
I know, but someone wanted to know the price for a friend of mine.
It varies in so many instances. So I'll give you the price in the United States. So a baseline price is about $20,000, where the actual instrumentation is about $11,000. But there are various degrees to the penile implant. So there's the Bentley, there's the Rolls Royce, there's the Toyota. There's so many different qualities of penile implants. So you can get one for $3,000 and you can get one for $12,000. So obviously that affects the price. Where the facility where you have the implant place also plays a role. But generally, if you're getting the top of the line penile implant in the United States, about $20,000. I do it for maybe about total $2,000 less. And I have actually over the years done medical tourism for erectile dysfunction using the penile implant. So you always say, wrap up, sun, sand, and being born again and rising again.
Okay. All right. Thank you very much.
Okay. So as I say, always treat the root cause of erectile dysfunction because it can save your life. Erectile dysfunction can be an early manifestation of something sinister going on. And there are many things that it can be, even low testosterone. Just because you have low testosterone, we need to determine what type of low testosterone do you have. And that medical term is hypogonadism. Is it primary or is it secondary? Is it related to, it could be related to various etiologies, but there is a sinister form of low testosterone that's related to a pituitary tumor, adenoma, where we need to, anytime you have low testosterone, we need to determine whether it's primary or secondary. We're going to look at blood tests, which are the precursors of testosterone, which is FSH, follicular stimulating hormone, and LH, which is luteinizing hormone. So that'll determine whether it's primary or secondary. We're also going to look at prolactin level. So if you have a high prolactin level, that may mean that the low testosterone is related to a pituitary adenoma. It's exceedingly rare. I think in 25 years, I've seen pituitary adenoma maybe 3 times. But obviously, you don't want to miss that and protocol is you got to check your prolactin level as well. And also, you don't diagnose low testosterone just on one reading. And you always want to have a reading where your bloods are taken. It doesn't have to be fasting bloods. We want the bloods taken before 11 a.m. in the morning because precipitously your testosterone level, both your free and total testosterone level, is going to fall into the afternoon, into the evening. So if you take it in the afternoon and evening, your values may be 15 to 20% lower than the actual value if you had taken it in the morning. And just because you have low levels doesn't mean that you need to treat the low testosterone. Only if you have symptoms, and it can only be treated with testosterone if you've ruled out prostate cancer. So testosterone doesn't cause prostate cancer, but if you have early prostate cancer, giving someone blindly testosterone is going to cause that testosterone to proliferate and progress rapidly. So it can be deadly to blindly give someone testosterone. Also, if someone has obstructive sleep apnea and you just give them testosterone, that actually can make the obstructive sleep apnea worse, which in turn make the testosterone even lower and make that vicious cycle of low testosterone and obesity and sleep apnea even worse than before. So you always treat the root cause. If it's related to sleep apnea, you treat the sleep apnea first. Then you, if necessary, give the person testosterone. But there are protocols in terms of testosterone replacement therapy. Just giving every 45-year-old or every 55-year-old testosterone is very, very, very dangerous. We have another call coming in. This is Urologist Speaks. Good evening.
Yeah, good evening, Dr. Pinto.
How are you doing?
Yeah, my boy, I got to come see you, but you see why I listen to you. 17 years is a long time in school, so I know. I always respect you, and so the last caller, what he said is very interesting because, with Google, right? When I read certain information, I'm not gullible and fooled. As a reader all my life, I'm able to use common sense. If I'm not going to juxtapose common sense with what I read, it's really harmful. But so for me, I stopped using those toothpastes out of the stores and things for like almost over a decade now. I've been using like charcoal toothpaste, neem toothpaste, and even the mouthwashes, etc. And then they have natural mouthwashes that maybe all of these things that we put into our bodies, Dr. Pinto, it has to have some type of effect if they're not natural. When you did chemistry,
very much
so.
So.
More in depth than I am, right?
I'm a big proponent for organic. Unfortunately, organic's usually more expensive, but if you can afford it, I'll be the first one to advocate organic everything, from anything that we use for our hygiene to any food or drink that we put in our body.
Yeah, but I remember I have a question for you too, but I remember a few weeks ago, and you was talking about the Abadat and how it can lessen the chances of developing cancer.
Yes.
But I remember reading years ago, and so I might have spoken to you about this before, but you're talking about the testosterone, and so they also talk about the dehydrated testosterone and the balancing of those two. I would like you to just expound on it a little bit, just to refresh my mind as to how it should be, because I had a very large prostate, and so even with the surgery, it had to be discontinued. And so what I noticed I was back and forward with the hematuria, right?
Yes.
That I call growth, but after all those years, still a little bloody, and then irrigation, et cetera. And so I came across, when I saw Dr. Roberts one time ago, and my father was around me to go to him, and me and him came to the same conclusion. And I was saying, if you could just expound on the testosterone and the dehydrated testosterone, and I believe I had the vascular regrowth, that why I was bleeding so on and off for so long. I'll just hang up and listen. I appreciate you, brother.
Okay, thank you very much. So as I mentioned, when I talk about medications and unfortunate side effects that can affect negatively getting an erection, maintaining an erection, or your sexual drive, at the forefront, I'm going to mention a drug that's widely prescribed by urologists, and that's finasteride and dutasteride. In fact, finasteride in lower doses is prescribed worldwide, and it's known as Propecia, to combat male pattern baldness. So unfortunately, it's not every individual, but certain persons can have a reduce in their sexual libido and their sexual drive with finasteride and dutasteride. And they can even have a negative impact on their erections themselves. So a lot of men find that, and they realize that, and they stop taking dutasteride and finasteride. In fact, it's not a medication that most men are going to continue or are going to be compliant with taking, because they notice it kills their erection. The advantage of taking that medication, first, it combats male pattern baldness. It can reduce your chance of low-risk prostate cancer by as much as 25%. So that's double good news. You can keep your hair, reduce your chance of getting prostate cancer, or low-risk prostate cancer by as much as 25%. But if you're unfortunately one of those individuals where it affects you negatively sexually, then you can give yourself, as urologists, we can give you something to combat that. We can give you, for example, a daily Cialis, tadalafil, which is generic of Cialis, which is relatively inexpensive. Tadalafil will improve your sexual drive, help you maintain your erection. It also helps you in terms of fighting off, as you get older, muscle atrophy and fibrosis of the male member. It also increases your blood supply to your male member. So it has many advantages. It's also important in terms of a treatment for BPH. And it's an FDA-approved treatment for BPH, benign prostate hyperplasia, in terms of treating your lower urinary tract symptoms. So studies have shown that if you take a daily Cialis, it can help you with emptying your bladder, having less obstructive and irritative urinary symptoms, in addition to taking Flomax, or in addition to taking Hytrin or Sopamedel. So there are many benefits to taking the daily Cialis. So even if you were to, for example, have an early onset or the first onset of erectile dysfunction, many urologists worldwide, the first thing we're going to do, obviously we're going to determine why you had that erectile dysfunction. What is the etiology? What is the cause behind it? Let's treat the cause. But to get your confidence back, to improve your blood supply to your penis, we're going to give you a daily Cialis. And most of the individuals who are faced with erectile dysfunction the first time for organic cause are going to be middle-aged and are already combating lower urinary tract symptoms because of an enlarged prostate. So the tadalafil does two things. It helps you empty your bladder, which in itself, who can really have a good erection when they have to pee all the time or their bladder is always full? And also it can improve your blood supply to your penis, which can be a confidence booster. It doesn't mean you're walking around with an erection. What it does is it enhances an erection that you've already gotten through any form of stimulus. So when we talk about the physiology behind testosterone and dihydrotestosterone and free testosterone, so the active ingredient that's most important in getting your energy and everything else is dihydrotestosterone. There's also interplay between dihydrotestosterone and estrogen. But that in itself, I did speak about that in a topic maybe a couple months ago, but I want to leave that for a topic where I think testosterone and understanding testosterone is so important that it needs a dedicated hour, and I plan to have that probably at the end of next month. So again, nobody's alone in having erectile dysfunction. Do not suffer needlessly. We're always going to treat the root cause, no matter what the cause is. Sometimes it's more than one cause. No matter what the circumstances of your poor health, we can always improve your health in any number of ways, but we can always get you to rise again. Even if your blood supply is horrible, even if you've had surgery where your nerve supply is no longer intact, the things that we can use a vacuum device, which is relatively inexpensive. It has multiple uses. It basically, as it is described, it creates a vacuum device. It creates a suction effect where it pools blood. You place a chamber over your male member. It's designed to do so. You pump it up. It removes the air from it pools the blood into your chambers, and you can get a good erection for maybe even 10, 12 minutes, allowing penetration when you have no nerve supply, no blood supply whatsoever. So you don't even have to go to the penile implant. We can give you injectables that inject active ingredient, whether it's Unimix, Bimix, Trimix, alprostadiol, paparavine are the chemicals, active ingredients that we inject into the chambers themselves, the corpus cavernosum at the base of the penis. Even you have zero blood supply, zero nerve supply, you would get an excellent erection. But it's not something you borrow from your friend, because we have to determine what dose is right for you. So we actually we'll use a lower dose, we'll give you that in the office We'll put you in a room and see what the erectile function will be with that dose. If we need a greater dose, we'll do so. We'll make sure that the erections come down. If not, we'll give you something to bring that down so we can determine what dose is safe for you. The last thing we want to do is get you that erection, and then after you've had ejaculation, you have a sustained erection where you got to go to the emergency room and we need to remove blood from your male member and go through a very unfortunate experience. So don't never borrow anybody's intracavernosal injections, because that dose that was prescribed for that individual by that urologist is for that individual. So it may be too strong for you, it may be too weak for you, but you don't want to take that chance. So there's always a trial effort, as a trial that goes on within the office confines, in privacy, obviously with complete confidentiality, to determine if you do need the intracavernosal injection, that we determine which ingredient and what dose of each ingredient is required for you to get that excellent erection. And then once you do get that erection, to be able to use that erection and then be able to not have a sustained erection beyond the time of you using that, being able to orgasm. So, as I always say, just as you don't borrow somebody's Viagra, just as you don't borrow someone's Cialis, just as I've been preaching for years to the baby public, stop going to the gas station. Your gas attendant or your cashier in the gas station is not your urologist, is not your physician, and buying these unregulated medications that are deemed supplements that never had to go through any human trials or any FDA approval, you take at your own peril. And then on top of that, you're not treating the root cause of your erectile dysfunction. All you're doing is treating the symptom, which is a danger in itself, because the cause is going to overwhelm you and cause problems to other organs and cause irreversible damage to your male member itself. So always get annual physicals. The more you pay attention to your health, the healthier lifestyle that you have, the more that you're going to have a good relationship with your physician throughout not just the years, the decades, the greater chance you're going to be able to maintain your erections into your 70s and into your 80s. And that's every Bahamian man's dream. You don't want your erections failing when you're 39 years old because you never took care of your health. So please listen to your body. If there's something going wrong, whether erections are failing you, and the most common form of erectile dysfunction is premature ejaculation. 30 to 33% of men of all ages, whether you're 18 years old or whether you're 88 years old, has some form of premature ejaculation. And there are two forms of premature ejaculation. That's that type that's acquired, where you had 10 years where it never happened, and all of a sudden it's happening periodically or all the time. That's acquired. Or from the day one you lost your virginity, you've always had premature ejaculation. Then we treat those differently. And there are medications that we can give you that can allow you to go from a 1-minute man to a marathon man. So please stop suffering needlessly for premature ejaculation. And how do we define premature ejaculation? It's orgasming before your satisfaction. So by definition, a man who wants to go 20 minutes and is lasting 18 minutes and is not satisfied, that's a form of premature ejaculation. Might be questioning his goalposts in terms of what he expects, but that is premature ejaculation. If a man lasts 30 seconds and he's happy with that 30 seconds, that's not premature ejaculation. So it's any sexual experience that ends too soon and leaves the partner unsatisfied or upset or dissatisfied. That is premature ejaculation. And it's an overwhelming problem. And I've seen men who suffered with it for decades. And if they had sought help decades before, they could have had wonderful sexual experiences without all the frustrations. And then as you get older, men who are fully aware of this, there's a refractory period. When you're 20 years old, you can go 2 rounds, 3 rounds, one after the other, one after the other. But for some men, as they get older, they might be 58 years old, they might be 64 years old, just to get a moderate or good erection, and it's over in 30 seconds or 45 seconds or less than 2 minutes. That's frustrating because you may not be able to get another erection for half a day or a day. And then when you do get that, it ends too soon again. So please stop living with this frustration. Urologists are readily available. We can get you to last as long as you want, as hard as you want, and improve your self-esteem and make you feel like a man again. Okay, we're going to take another break and we'll... Oh, sorry. Time has gone so quickly. We've run out of time. This topic has just gone on and on. There's so much to speak about it. But thank you very much, as always, for your loyal listenership. It's a pleasure to be serving my Bahamian people. And as I always say, the health of the nation is the wealth of the nation. Always treat the root cause, live healthy, and never suffer needlessly with erectile dysfunction or any other ailment. Always seek the help of your urologist or physician or internist or anyone else. We'll speak again in another week. Good evening and have a safe week, Bahamas.
Live better, live stronger, live stronger.